So why are South Africans grinding their teeth and snoring more and sleeping less? So, according to Dr. Steven Olmos, a founder of the Temporomandibular Joint, I hope I'm saying that right, and Sleep Therapy Centre International, it could all come down to the jaw. So Dr. Olmos is in South Africa to launch the country's first TMJ and Sleep Therapy Centre. It's a major milestone in health and wellness, health, dental medicine, and sleep science. And he joins us now, Dr. Steven Olmos, TMJ and sleep expert. Doc, thank you so much for making time to speak to us here on SABC News. And I'm so interested to know how all of this is connected. So, grinding our teeth, we're snoring more, and we're sleeping less. Talk to us a bit about that.
Yes, well, thank you for having me on. It is a global crisis. Every person in the world has a jaw problem. Every other person in the world has a problem breathing at night. And so with that kind of frequency, the relationships between the problems that people have with headaches, facial pain, jaw dysfunction, it's really quite a striking epidemic, if you will. And so really the jaw problems are the fever, if you will, of a disease, not the actual problem. The real problem is that people can't breathe, and they have to continually to move their jaw to breathe at night, whether they can't breathe through their throat or they can't breathe through their nose. And this causes their jaw and face to hurt. And when your jaw and face hurts, then this causes postural problems. And now we have neck ache, back aches, and all sorts of other extremity problems. So the jaw is not isolated. It is a primary issue because the brain gives it much more priority than any other joint in the body. Because the brain is very worried that if there's an issue with your jaw, that you can't eat or breathe. And that's very high on the survival list of things that would threaten the brain.
Yeah. And I mean, what are some of the contributing factors to this? I know you speak about the jaw, you center it around that, but how do we deal with some of these challenges? I mean, not getting enough sleep, that can't be good for anyone. Snoring on its own, that can't be good. Talk us through, how some of this assistance comes through in trying to deal with some of these challenges.
Right. So disturbed sleep obviously is going to result in fatigue during the daytime. And then, of course, if you're tired enough, long enough, you're likely to be diagnosed with some kind of chronic fatigue issue, depression. You're probably going to be prescribed some medicines for either anxiety or depression, especially if you wake up anxious. Very often you're waking up anxious because you've been suffocating.
Yeah.
So you're prescribed medicines, but the medicines actually shorten your sleep. They lighten your sleep from restful to lighter sleep. They make you grind your teeth more, and they decrease your rapid eye movement sleep, so you have less cognitive ability and you have less ability to remember anything that you've learned and experienced the day before. So there's a whole combination of errors here. And why are we having these problems? Is because our heads are shrinking. We are consuming softer diets. We are eating diets that are higher in carbohydrates that result in inflammation. Sugar shrinks your brain, sugar shrinks your head. As we have smaller skulls, we have less ability to breathe. And we see this in more crowding of teeth. And so all these things are related. So where does it all come from? Really, probably pretty much started with diet. And now we inherit every generation of these kinds of issues. And that's why we're seeing all of the frequency increasing. And we're also seeing the neurocognitive component. So in our country, children 1 in 9 have ADHD. So we're starting to see the consequences of these issues.
How do we solve these problems? I think that will be the next question. If we've got a worldwide problem in dealing with this, how do we get solutions to address some of these lack of sleep, the jaws clutching?
Well, we need early identification. We need to be screening children because all the adults who have these issues, they were born this way. and they've had these issues their whole life. It's just that they magnify to the point where they are identified and then treated as an adult. At least we're starting to now. But if we would screen children for these kinds of problems, then we would see that we could get early treatment and children would have a completely different life. And then their offspring would have a better life. So identifying in childhood and treating early is the key. And that's really our mission, is to educate.
Do we have enough specialists, though, to actually detect all of this at a very young age? Because if someone is born with it, that is why we're having a situation now where perhaps people in their older age that would experience problems of snoring, clutching their jaws, not being able to, sleep, lots of snoring that's going on. Do we have enough experts to diagnose this at its early age?
Well, you hit it right on the head, is that we really don't have that many trained professionals. We need to have more education in our schools, in medicine and in dentistry. About 1 hour per year is given in education for these kinds of disorders, which it's far too little, both in medicine and dentistry. So that's one of my missions, is to help integrate these kinds of this information and teaching so that we can be producing physicians and dentists with their eyes open and ways to be able to identify and treat early. And so that's what we're doing now. We're spreading the word. I'm going around the world trying to get people to understand that this is a global issue, and we all need to raise our education levels. Absolutely, you're right.
Dr. Steve, thank you very much indeed, and I hope that all that you come up with will assist in some of these challenges that we're experiencing. Thank you very much for joining us here on the SABC. We really do appreciate your time.